Did you know that simple, healthy lifestyle habits can be powerful weapons against chronic diseases such as diabetes, heart attacks, strokes, and even cancer? Let me share with you highlights from a study to illustrate to you the tremendous power of healthy lifestyle habits in preventing chronic diseases. The researchers in this study got more than 23,000 people aged 35 to 65 from Potsdam, Germany to participate in this study. They follow up on all the participants regularly once every 2 to 3 years, observed their lifestyle and dietary habits as well as the incidence of chronic diseases amongst the participants over a period of almost 8 years. The 4 factors that they monitored of the participants in the study were whether they smoke, whether they kept their BMI below 30, their dietary habits with a focus on whether the participants were having adequate intake of fruits and vegetables, as well as physical activity level, whether the participants took part in any form of physical activities for at least 3.5 hours per week. They also monitored whether the participants developed any of these diseases during the study. And at the end of the almost 8 long years of monitoring and follow-up of these 23,000+ participants, this was what the researchers found. Participants who practiced and scored well in all the 4 healthy lifestyle factors as defined in the study had a almost 80% lower risk of developing a chronic disease than participants who did not maintain any of the 4 healthy lifestyle factors. Wow. Something to highlight here though, this was an observational study, so we can only tell that there was a clear association of the 4 healthy lifestyle factors defined and monitored in the study with the incidence of chronic diseases. So therefore we cannot say, not based on this study at least, that there was a clear-cut cause and effect. So what were the key food for thought that I hope you would take away? Firstly, seemingly simple healthy lifestyle habits, if practiced consistently, can have tremendous power in preventing and combating chronic diseases and even cancer. Therefore, regardless of our age or current states of health, to the degree that each is willing and able to, we should constantly strive to improve and optimize our lifestyle and eating habits. Finally, and most importantly, in this critical fight against lifestyle-related chronic diseases, lifestyle and diet must be the cornerstone of what we do for the prevention and holistic management of chronic diseases. Lifestyle and diet, and not drugs, must be the main weapons we use to fight against these devastating diseases that can take away years from life and life from years.